Hello? Hi. Are we here?
Still waiting. I still just see the logo, the Halcyon logo. I don't know.
There might be a little delay on this. This is something that's...
Oh, okay.
There might be some latency.
Okay.
Thank you for hosting these weeks. Someone's here. It's Jan. Hi, Jan. Can you hear us?
Hello, can you hear us?
There we are.
Okay, so I think there's a little bit of a lag. There's about a 30-second lag, Shay. So people are
Let me
behind
mute this. Okay.
All right, so hi everybody. Welcome back to another weekly Q&A session here. We wanted to introduce ourselves. We figured we've been doing this a long time, and most of you know us already. We're going to talk about biases and all of these other things. And one of the things we always forget to do is introduce ourselves and what we do and put that into context of whether or not you should listen to us or whatever questions you have. We are always open to that. So my name is James Gaor. I'm a physician at Halcyon Health, Direct Primary Care.
I'm Emily Scott, also a physician at Halcyon Health.
And Shay?
And my name's Shay Suskin, and I'm one of the newer physicians. I joined Halcyon Health this January, and family medicine.
Great. So yeah, we wanted to put that out there because, once again, most of you know who we are. Some people are sharing this to family, friends, so I think it's important for us to share and be transparent who we are and why we're saying these things and to qualify any of the statements we make and clearly answer questions about that. So again, welcome. And so one of the things we wanted to talk about today was what's happened since last time. There's some new studies, there's lots more questions. There's we talked about reopening Orange County last week and what that would look like. Even as soon as yesterday, there was a lot of talk about opening and having plans for phases of opening, not only in our state, but also here in Orange County. So I thought it would be good to talk about that. There's also lots of various social media posts, if you will, that are very polarizing in many ways. And so trying to clarify that, trying to maybe explain some basic statistics of what some of these things may or may not allude to. And at the end of the day, how can we move forward and what's uncertain? And one of the things we've talked about just now is, and Shay mentioned this as well, is feeling more comfortable with uncertainty is really kind of our new normal. And it actually should have been our old normal, but now we're kind of forced into it in terms of feeling a little more comfortable with it and not having answers immediately to us and making some guesses and being wrong and having the resources to adjust and all those types of things. So yeah, so I guess we can do stats, right? We can talk about Orange County in particular, and I'm just going to pull up a website here. I can share things now. So we updated this a little bit. So as of this is April 28th, in terms of case count, you guys can take a look already. It's pretty self-explanatory. I think a lot of people are more interested in the trends. And one of the things that was mentioned earlier was about how Orange County specifically is in the planning stages of trying to figure out how to open up various parts of our economy again, and the public parks and beaches, which once again, that's a polarizing topic as well. So Emily can, I guess, kind of allude to what we see here in terms of numbers and all those types of things.
So this is looking at case counts, this blue trend that you can see here. Day to day, they're reporting how many cases were reported in Orange County. And as of yesterday, April 28th, there were 34 cases reported. And you can see that's down from 122 reported back a few days ago. So, and of course, reporting depends on how many people were tested and where they collected the data from. So we can kind of see how that trend looks like it's had some peaks and troughs, and it's not any clear statistical graph right now of something where you can see a trend that's clearly increasing or decreasing, but more this up and down type thing. So we're keeping a close eye on these case counts. And then this one here in orange, or wait, which one are you going to here?
I'll let you drive.
Let's see. So now we're looking at cumulative cases, right, in this orange graph here. So you can see over time how it's adding up, basically how many. So every day more and more people are diagnosed with COVID. That's kind of a given. This is how many people we test. And so you can see that number, again, is fluctuated, but there is a clear sense that this number has increased in general since March, when we were testing 11 people a day. Now we're in the thousands, or high hundreds to 1,000 people that we're testing every day. Here it is that, here's cumulative people tested. I'm going to kind of roll through that. And then these are patients hospitalized in Orange County, this graph that has orange and blue. So this one you can see basically the patients that are in blue are the ones in the ICU, and the orange are the people that are in the hospital. So again, we can kind of see a trend that almost looks like it's increasing here, but doing this up and down type thing. Currently, it looks like there are 74 people in the ICU and 178 people in the hospital, which is higher than we've seen. Let's see. And then we talk about age. This is kind of breaking it down by demographics. I'm going to push through this quickly. And then they break it into cities, which I'm also going to push through quickly. I think that's it. That's all we were going to review there.
Yeah, so that's kind of the summary of where we're at. And I guess the question then that we've been talking about, and there's been a lot of polarizing things in terms of what to do now, right? And so we've been having this conversation on and off over the past week is, what's the next step, right? So I don't know what your thoughts, Shay, are in terms of, what we've been seeing and some of the phases of opening up. What are your thoughts?
Sorry, I'm somewhat distracted by, I don't know if you just saw,
yeah,
but I typed there. There's a lot of
noise.
Feedback, like white noise that gets louder when I talk. Sorry, forgive us, we're playing around with the new setup today, so I'm not the floating iPad that I normally am, but I don't know. Do you guys, I don't know if there's a way we can fix that. That does seem to get, I still hear it, but it went down a lot, so that's good. Sorry about that.
Sorry.
I want that to continue throughout the whole feed because it would.
I didn't hear it. Sorry.
Drive people and myself crazy. That's okay. I think it got a little better. Guys, let us know if you're still hearing it or if it's. So I'm sorry. Back up. Where were we?
Oh yeah, talking about next steps, and we were talking about studies that were being done about antibody testing and updating people on that, and how is that affecting our sense of comfort in being able to open up. Controversy about that, once again, looking at this locally, looking at this nationally, and the new normal here in Orange County specifically.
Yeah, well, definitely don't feel like I have clear answers on any of that. I think the conversations that we've been having are, again, back to what we keep reemphasizing on these, is the comfort with uncertainty, and just it's becoming more and more clear that there are many different perspectives that we need. It's a complicated question of how to reopen, and there's definitely some good signs that that the overall trend of case counts reported, like Emily showed, that initial blue graph, case counts reported every day seems to be going down. If that continues on the downward trend, that's a really good sign. The low death rates that we've had here in Orange County locally, there's a lot of promising things that we're all asking this question of how is it going to look for us to reopen. And being a medical doctor, many of us, our perspective is going to be our priority is going to be how do we decrease deaths? How do we do this in the safest way possible? The epidemiologists and scientists they're going to say this, if we open in this way, they're only going to be thinking about what do we project in the way that's going to affect death counts. So that's an important thing to consider, but it's important to remember that there are other perspectives. It's also very true how much, the long-term harms that total lockdown can have. So we have to just, we've just been talking about, you need to bring different perspectives to the table. City planners, small business owners also need to have a seat at the table of how to reopen, and those need to be very nuanced conversations. So again, no clarity on what that looks like, but I'm feeling encouraged that we're going to start to find our way forward and reopen. We definitely, maybe James and Emily can talk a little bit more about, these phases of what reopening might look like. But yeah, I think we're getting closer to that.
So one of the things that is interesting to me is we just looked at that data showing that actually we have more people in the hospital now related to COVID than we actually ever have, and Orange County is having real discussions about opening things up. And so I'm hearing people concerned, why are we doing this now when maybe the case count's still possibly going up, maybe the hospitals are more full now. And so the question is, why now? Why, when things are still going up, are we starting to open things up? And part of what the way I see this, and I'm trying to look at the big picture. Why did we implement this social lockdown in the first place? Why did the powers that be or the experts recommend this? And the thought was that if we didn't, there could be the potential for a need of hospital resources that would extend beyond what we have. And so now, and maybe we can put up that IHME website. So this website has been tracking the death rate, and this is the one that we showed last time too. There seems to be some degree, again, we can never be too certain of anything, and that's one thing we keep saying. If anybody seems really, really certain that they can predict the future, then we should not trust them. But it would seem that there's some certainty that in the U.S. as a whole, that we have passed the peak of daily deaths, or that we've gotten past the peak as a country as a whole, I hope. And so the thought of further utilization of resources becoming this inevitable tsunami is not clear now. So to say that again, because I think I'm being confusing, back when we looked at this in March, the predictions, the modeling suggested that if we did nothing, it was possible we could have this need that way outstretched our capacity in the hospitals, and people would die just because we didn't have enough hospital beds. And so in my mind, the intention of this was to slow it down so that we could give people the best chance to survive this. We would have the resources there. And so what we've seen is this big wave coming through, and it seems like we're coming down the other side of it and across most of the country. And what we've seen particularly in Orange County, that we have not come to a point where we've needed more than our hospitals can provide. And so we're still in a place in Orange County where we can release the valve a little bit, where we can open things up a little bit maybe and see what happens with the demand or the need in the hospital, and then reevaluate. And the difference between now and early March, when it was like just shut down everything, is we have more data, we have more exposure, we have a sense of testing. We're testing a lot more, right? We were testing, like we just looked at, 11 people in March, and now we're testing 1,000 people kind of on average a day. So we have more clarity on the data, so now there's more room to open things up and find that balance that Shay was talking about between people's livelihood, people's mental health, and people's exposure and death from this virus. So I think that's how I see it now, and I think we all have to have our own personal sense of where we feel safe and how we want to approach it, and we also have to have grace and love for our fellow humans and their way of approaching it, and make sure we're all respecting each other. That's kind of where I would stand with it. So.
And all this, I don't know if you want to call this successful, or the results of what we've seen here is really been built on social trust. So when we think about everything that has been required of us, we've done this because of a trust. We've done, nobody's been heavy-handed in terms of enforcing any of this, not only locally but nationally. And so it is encouraging that people have been able to do that. Yeah. It's encouraging to me in the future that as we decide to open up, that people will still maintain that social trust, and that requires, once again, this sense of caring for others in addition to looking out for yourself. But really, this is a community effort. And going back to what Emily said, I think we have had enough time to really understand and prepare for what this looks like moving forward. And really not much has changed in the sense that, we don't have all this drastic new information necessarily. Mm-hmm. It's still an infectious disease. It still can kill people. We are finding that, there's probably more prevalence of it. And we kind of knew that already, but now there's a little bit of proof of that. And because of that, the fatality rates, and once again, that's a dicey topic of case fatality versus infectious fatality rates. But regardless, all of these things depend on us being mindful about how our actions affect others. And we have a system now that is being put in place that can help test, that can help monitor. And when the cases do rise again, because once again, I do want to put that out there, when we start opening up, the cases will rise. Right. We do have to be prepared for that, and we are going to have to live with that moving forward until, once again, this notion of herd immunity, whether it comes from us natively distributing it to each other versus a vaccine in the future, that is the end goal of this at some point in the future. I don't know when that's going to happen, but we have to learn to manage this, right? This isn't going to go away. This isn't going to disappear. There isn't something that's going to happen drastically anytime in the short term. So we really have to have these conversations and feel comfortable with that. And that's a lot easier said than done. So that's why we're having these things and hosting these types of things.
Yeah, and even these questions, I struggle with these questions about sort of people looking back, and sometimes I feel like people are angry, like mad that that we've all stayed home, and as I do relate to that, I also feel like it's really hard to go back and try to make a statement about would have, when, had we not, and so I feel like that's almost like wasted energy. And so I feel moving forward that we need to start focusing on making slow movements and watching what happens and looking at our resources and coming back. And as much as we can avoid being angry or politicized or polarized about this, I think we will all just have better mental health as we go through this together, because it is going to be this ongoing incremental decision making. It's hard to make any sweeping decisions right now. So
yeah, and it's encouraging. I think we're making steps in the right direction. Once again, it sounds encouraging that the Orange County Public Health yesterday made some optimistic statements that we have plans in place, clearly, as we should, in terms of handling more testing, being able to have enough contact tracing in the future. That hopefully, they are ramping up their resources in terms of employees to help do that. One of the shortages that hopefully will be overcome shortly is really the personal protective equipment. So hopefully we have enough resources about that. And once again, working together is really the biggest thing. And like Shay mentioned, this isn't just about scientists and number crunchers. This is really about the broader community, because this is devastating, not necessarily just on a medical illness perspective, but mental health, economic, all of these things are clearly devastating. And once again, these problems aren't in silos. They're all related to each other. So clearly the solution has to be an interrelated solution as well. So it's promising to see that. We have some comments. Julia had mentioned about yesterday about schools opening in July, August, potentially. I know he said that yesterday. Do you have any info on whether kids are vectors able to transmit the virus? Have heard they haven't seen many cases of this. Any comments on that, Shay?
I don't know the answer to that, Julia.
I don't think in terms of many cases, I think that's because kids aren't being tested, because we've been seeing since the beginning of this that kids on the whole aren't getting, aren't at high risk of being hospitalized or having more severe symptoms with it. There have been, a few deaths of kids even as young as 5 that were positive for COVID. So I've read that, I've seen that happen, but I don't think we have real data on that because, there aren't large scale numbers of kids being tested. But the way viruses typically work, we don't have any reason to think that they wouldn't be. And in general, kids are usually very much germ vectors. It's a lot harder for kids to understand, or to have discipline around not touching each other and not touching, their caregivers and touching their own faces and all of that. So the way viruses typically work, we have reason to assume that kids should be able to transmit this, but I don't think we have data.
Yeah, so I think, on that note, and I think Julia is having a follow-up question on that. So in terms of transmitting the virus specifically, I think it's very possible that they are. I think going back to kind of what we talked about before, taking calculated risks at the end of the day, do we have the resources to handle this? At some point, we have to have an education system. What that looks like is still up for grabs in terms of, is this back to what it used to be like before, or is it have to be modified in a particular way? But kids have to go back to school, and so how do we negotiate that action? And I think we have to be in a place where, fortunately, kids, like Shay mentioned, don't have bad outcomes. If they do become vectors of the disease, specifically COVID, then we should, if we have the proper planning and resources, be able to really detect that fairly quickly and understand how to approach that. So we shouldn't be couched in fear. We just can't stop indefinitely. We have to have schools open, and so how do we do that? And we have to accept a certain amount of risk. And once again, going to that uncertainty, we have to be comfortable with that risk. And some analogies are, we've lived with this risk in the background every day when we get into our car, when we fly a plane, when we do certain things, our lifestyle, all of these things. It's just now in the forefront of our mind, and so we really have to confront it in a very cerebral way. Once again, it's something we do regularly. Now we just have to deal with it together, I guess.
I think also my understanding of, we don't know a lot about pandemics. The last one that we really experienced was 100 years ago, and so everything that we've thought about pandemics has been based on modeling and assumptions. And part of that modeling was that closing schools was one of the more effective tools in stopping the spread of a pandemic, and that's in a generic term. So I think nobody knows what's going to happen with this particular virus in this particular pandemic because we've never been through it. So kind of to your question, Julia, it's possible that they're not transmitting it, but it's also possible that they are, and we're going to see the numbers jump, like James is saying, and we have to just take it a step at a time.
Yeah, this is an experiment, and honestly, this happened so quickly that we were so aggressive about the lockdown. We don't have enough numbers to conclusively say yes or no, or even a risk tolerance of they're low risk, high risk.
Right.
I don't have an answer to that, but we have to find the answer, and the only way to find the answer, honestly, is just to be mindful about opening and be aggressive about testing and following those things, and we have to be a little bit comfortable with that unknown.
And to do this, 3 months ago, just, open everything up when we know nothing and we have no sense of really how bad it's going to be, and looking at resources and amping up testing, that would have been reckless, right? And tomorrow, I do believe tomorrow, if we opened up every school, every concert hall, everything all at once, I think that would also be reckless. I think because we have this unknown. So I think we can feel safe in our thoughtfulness about this slow reintroduction of things and take it from there.
Yeah, I think exactly. Go ahead, Shay.
I think it's certainly true that we're in a better place now. We have, so many more testing sites open and a better understanding of the accuracy of tests, and we've played around some with self-quarantining at home and knowing what works and what doesn't. So those are all really helpful and can help us feel safe for reopening in this phased-in approach. But we're still, there's still so much ground to cover. What's scary is that we're still really don't have real clear or great treatments for this. And so that makes it, it doesn't mean that we can't open it all, but that's something that's still really missing. Like we don't have great data for great treatments for COVID yet. So that, I'm just making the point that we have some resources now in place that we didn't have that are going to make it a little safer to open, but we still have a long way to go. And so I think that's why it's so important to do this in a phased way. And someone asked a question about, can I have hope that as a 65-year-old, I won't have to be on lockdown forever? I think absolutely, yes, you can have hope with that. We're going to get there. But it does make the most sense to think about doing this reopening in a phased in way, and try to, every individual is going to need to kind of wrestle with, and as your doctors, we can hopefully help you do that, wrestle with your own particular risks and your own health risks and underlying conditions, and balance that with what your life looks like and how, what exposures you may or may not have in your daily life. And so we just have to not go in blindly and say, okay, tomorrow let's wake up and go back to normal, but do these things in a very thoughtful, slow trial and error kind of way.
And that speaks to, I think that's the most hyper-local you can get, right? So we talked about these broad, blunt hammers of, shutting everything down and putting everybody in isolation. And then now we're talking about locally, how is it affecting us here in Orange County, in my particular city? And we're all related, so it's very important to understand our local communities and neighboring communities as well. But to your point, Shay, this is our privilege to be able to talk to you individually and counsel everybody on the risk benefits. It's like, hey,
right.
You do what you got to do, and if it's right for your mental health and you feel like you're able to accept the risks associated with that, then I think it's okay, as long as we understand that and we're on the same page. And once again, the social trust is still solidified. I think that's the most important thing, and each individual has to make that decision, but we're doing it together at the same time. So there's a couple.
And to this question,
yeah.
Sorry, yeah.
Go ahead.
Go to that. This last question here of, do you think there's a risk of increase in infections, increase in case counts as restrictions are lifted? There is absolutely that risk, and we're already, they're already seeing some of that in Texas. Some restrictions were lifted, and I'm hearing that they're seeing an increase in cases. I need to read more about that, but absolutely, that's what we expect. So again, we can't just completely be ruled by fear and never leave our houses again. There's no quality of life there, but we need to slowly move forward and try to balance that risk and cautiously open what seems to be lower risk settings and trial and error and move forward from there.
How long we hold off on opening, meaning no matter what we do when we release this valve, there's an assumption there too, of course, but the thought is no matter what, how long we wait when we release the valve, there's going to be more people who have it. And the question is always about what's our capacity to handle it. So how good are we at contact tracing? How good are we at how much hospital capacity we have? So that's what we've been saying over and over here.
Yeah, so it's once again, it's likely going to happen. I would bet on a second wave. How big the wave is, and how we're able to handle it is really the biggest question. Sorry, I'm playing with this and I'm putting overlays and not muting when I.
Can you guys hear us? No.
Sorry. No.
Okay.
There's a time delay. So, sorry. That's my fault.
David, I don't know how they're going to open Disneyland. It's going to be interesting to see. I wonder if they will
definitely relate with that comment, though. I'll put that out there. My family, cannot wait. That's going to be our big sign that we're back to normal once that happens. But
right? Would they
wipe
down?
You, Emily. I think, public health wise though, that's why I feel like it's going to be the biggest sign that we're through this, is because that's probably lowest priority, right?
Well, churros, I think, are good to prevent.
What's that?
Nothing.
True.
He's talking about eating
should be
Sure.
trialed as a treatment. Why not?
So Fred has mentioned, and we were alluding to this earlier. We can talk about this now since there's a lot of questions about testing, right? So let's see. I think Fred had mentioned a couple.
Fred, do you mean a false negative or do you mean a false positive? I wonder about that.
So accuracy. We can talk about accuracy in general.
Right.
So once again, going back to the initial statement that there's just a lot of stuff going on, and we were talking this morning about the news cycle is much faster than science. And so to put that out there, for us to pretend that all of these articles that are reporting studies, which haven't even been peer-reviewed or even published in a journal yet, that somehow we can get a lot of conclusions from those, it's way too premature, and we're craving that in a normal way. So going back to the question of testing, we don't know really the accuracy of a lot of these tests. And so we mentioned this last week. We pulled out of doing point of care finger prick testing in our office just because there's a huge amount of questions about that, and I didn't want to have to deal with the question of, are we testing people remotely accurately? And then there's the next step of applying statistics to the data. Let's even say they're accurate. Then we have to understand how to apply the data in a way that is providing meaningful knowledge. And so this is where it gets really murky in terms of I can create a data set and I can use the data incorrectly using statistics in an improper way to gather a number that can be scary or can be really optimistic. And so we really have to pull back and say, okay, what are the numbers telling us? And regardless of how I feel and try to put as much as my bias aside, how can we use statistics in a very rational, logistic way? And what's the number? Am I happy with that number? Does it make me feel sad, scared? To be honest, it shouldn't matter. It's the number. It is what it is. And that's really hard. And I'm not pretending like that's going to be something that's easy to do, especially in a news cycle or when we're trying to get a message out. And what's my agenda? What's our agenda for doing these live streams? All of you should question that. And so those are really big things to keep in mind in terms of statistics. So we can go into detail in a little bit if you want, but in terms of antibody testing, we've been doing antibody testing. We've I don't know how many we've done now.
Like 70? Well, no, maybe more like 80 now, but some of them are still pending.
Some of them are still pending, and once again, they're all negative so far, aside
we had
from
one. We had
one positive, which was appropriately positive in somebody who was a close contact with a COVID positive patient and who was COVID positive themselves.
Yeah, they had a positive swab.
So it makes sense. And then there's questions about IgM and the sensitivity of that. When does it show up in terms of the testing cycle? There's questions that it might not show up at all for a lot of people. So that just goes to show it's really hard to determine how to apply these tests and get knowledge from these tests at this point in time. We will get more knowledge and information as time goes on. So people who are contributing to this data set, that's what we're getting out of it, is trying to figure out how we can interpret this. And so coming to conclusions at this point is very premature, especially if you're using incorrect statistical methods to come to a conclusion, which we can talk about.
Makes sense. So we're doing, we're still using Genolite for antibody testing. We also now, Quest and LabCorp have it available. LabCorp has been more committal to that it's covered by insurance. They put out a statement that we've gotten from them stating that that insurance will pay for the COVID antibody testing. So we were thinking of leaning towards using LabCorp more. Quest has been not as clear with us, so we're always trying to help you guys out with the billing through insurance and the lab work that we help facilitate for you guys. So we just want to tell you guys it's so tricky because we are getting different information from different places about this, but we're trying to figure out the best way to steer people so that they don't have to pay for these tests if they have insurance. So we're starting to use LabCorp a little bit more now. And the way that LabCorp, and maybe shouldn't get into this, but the way that they run the antibody test is slightly different than the way Genolite does it. It's a different technique. And there's questions about false positive versus false negative for the different techniques. And I don't feel qualified to discuss that. So my knowledge on that is limited. As much as I've been trying to read and talk and ask, it still seems like it's not clear. So for now, if people want to have a verification and have their results sent to 2 labs, we can talk about it. But again, as far as cost goes, we're not sure how that would work. If your insurance is going to cover 1 test, are they going to cover 2? And so we would really want people to have some clarity on cost with that and if it's worth it. So I don't know, did I confuse things more?
Yeah, I think that's right. And the statement that I want to make too is, really at the end of the day, the government has mandated that private insurers, group employer plans do need to cover these tests. And so once again, as commonly happens, it's just very challenging with large negotiations between insurance companies and laboratory companies, how that works. That's why we do what we do, so we're out of that. But it should be covered, and I use the word should. So it should be covered. Speaking to the sensitivity and specificity of the test, once again, all of these tests, none of these tests are FDA approved. Once again, everybody is an early adopter if you decide to do antibody testing. And also, too, at the end of the day, we had this discussion with every single patient who is interested in antibody testing. It doesn't really change our recommendations for what you do, right? So social distancing, it's the same recommendation. There's no immunity card. In fact, I'll say right now, I just don't see that happening anytime in the near future. There was mention of that maybe weeks ago. Are we going to carry something to make it easier for people to travel, work, etc.? Based on what's out there, I find that highly unlikely, at least in the short term, that these antibodies will be useful from that perspective. I think it will be useful from a public health perspective of saying, like, okay, here's a hot pocket, here's this zip code, it seems like there's a lot of prevalence, what should we do about it? In addition to positive COVID cases. So that, to me, is the utility of these antibody case studies. Some people really are just incredibly curious, and from a mental health perspective, they feel like this can help them. I'm not totally opposed to that, but once again, it doesn't really change your day-to-day, the day-to-day recommendations of how you live your life. So there's that.
It's also difficult for us to draw clear conclusions about the prevalence of the disease based on these antibody tests. In other words, like making a claim that because this many people have tested positive, it means this percentage of population has had it, also feels premature. It's so frustrating, right? It's like we just want something to be meaningful. But we have to tread so carefully, and maybe in a year or two we can look back on this data and make sense of it. But we just have to be careful about how we act on this data. As far as offering the testing and capacity, we now that we can send this to LabCorp, we don't have to do our
Quest.
Or Quest.
And
Quest. Yes, and Quest. We don't have to do our batch everybody in a couple days and then drive down to San Diego. So we can open this up a bit more. We have capacity, so if you guys are interested, just send us a message. We are still offering this to members outside our practice. Of course, if that volume gets in the way of our patients, then we will back off on that. But it's more of like family and friends and word of mouth. We're not trying to be out there testing everybody in Orange County at this point. We just want to be able to offer that to our patients and do what we can to help out our community of people, if that makes sense.
Yeah. We're not pretending to be some type of research center collecting data and doing that. It's once again really more of a hyper-local effort for us to help our community, seeing what's out there, and once again being educated and having these discussions with you about the limitations and what it does and doesn't say. And that's the really most important thing. And I think that's what's lacking in certain places. And I'll talk about Quest specifically now has a direct-to-consumer testing done for antibodies, and I think that's questionable from my perspective. I think access is incredibly important, so I think to be able to have access, I think it is a great step for that. But I think to have testing so quickly without clinical context and to have somebody walk you through what this means and what it doesn't mean could be a little bit dangerous, but that's my personal perspective. Feel free to disagree.
Yeah, maybe if people are going out there and getting the tests on their own, they can consult their doctor who may not be offering the test through their office, but they can then use that information and come back and ask their doctor some questions. That would be, I think, of the greatest value. And I think about how, people outside our practice are coming and asking for testing, and we're providing that counseling, which is great for us to be able to do, but I also feel like if they have a primary doctor that they can consult with, that would be good for them too. So I don't know if I'm saying the right thing, but.
Mm-hmm. Somebody asked a good question here, but before we get to that question, I was just thinking and having this discussion about our specific office and how we're doing antibody testing. A while back, Lori had asked a question about if our office specifically is talking about how we're going to move towards reopening. And don't let me put words in your mouth, guys, but the way I've been looking at this is, I mean, we haven't ever closed. We're available, and we're still seeing patients that have a concern going on that needs a physical exam, or that we need to actually see you. So I don't, we didn't cancel like a huge list of appointments. We've just been switching to phone appointments, and many things we've been, able to take care of by phone, and we're still moving forward with blood work that needs to be done and all that sort of thing. So, yeah, thankfully our practice, since we're, tend to be in close touch with you all anyway, and hopefully you all feel like you have easy access to us. We don't have like a long list of patients that we're going to reschedule as soon as we open up. We're seeing patients as they need to be seen. And yeah, I think we do have some reminders set for ourselves, patients that need routine things like a pap smear, we're going to check in about that when it makes more sense, hopefully in a month or so. But yeah, I don't know, James or Emily, anything else to add about specific conversations we're having about how to reopen, when to reopen? I just wanted to make the point that I don't feel like we've ever been closed, and we're here, if you need us.
Yeah, no, completely agree, Shay. I think what I've been telling people is checking in with them. Hey, is this something you feel is really urgent, or something I feel is really urgent? And if so, we take care of it. And then as we start to do more non-urgent things like routine blood draws and pap smears, we are going to plan to have, as much as possible, people wait in their cars in the back, like we've been doing that. We come out to you in your car, you kind of call us or text us. We are having patients wear masks when they come in the office. We are wearing masks and gowns and all of that. We're, of course, not going to have a coffee machine for a while. We're not going to have snacks out. We're going to try to provide water in a very sanitary way. We're wiping down everything between patients. We're not going to have books in the waiting room that people can grab, and hopefully there won't really be people in our new lovely, beautiful office sitting around. So people will be coming out to you in your car and bringing you in for what you need, and then taking you back out to your car. And I do think, one of the beautiful things about DPC is this openness and availability of telehealth. I mean, that's what the beauty is of our practice. So maybe all of us have learned that we can handle more on the phone than we realized, or maybe we've learned that we actually need that physical contact and that being person to person for some things, for that emotional support or whatever it may be. So finding that balance for you guys, we can meet your needs where you are and help counsel you about if it seems reckless or if it seems reasonable for us to move forward. At this point, I do feel like it's somewhat reasonable to start opening up for some more routine stuff, and I've been doing a few more routine things. I think I'm doing a pap smear tomorrow. So it's really about your comfort level, and we'll take it from there.
Yeah, no, I agree 100%. We're ready, and once again, we're taking precautions, and we have the resources, and we understand the workflow. This is different than a month or two ago when so many unknowns, and what do we do? And now it's pretty clear what we have to do, and we're able to do it, so we can accommodate people. There's a great question from Anusha, and I'm going to play this again. Does California have a mental health hotline? And I think there's a couple of responses. I think I'll put this one because I think it mentions everything here, where, if you're definitely experiencing some mental health issues and crises, there's definitely support systems out there. We'd be happy to connect with you if you can feel comfortable doing that, making that leap already, but there's definitely a lot of resources out there for people to get help. This is, once again, we talked about this last time, the next wave of, and we might be in it already in terms of mental health issues, and the toll this is taking on everybody's mental health for obvious reasons.
And then Marcy Black asked about, would the tests be done in the office or still curbside? Can both tests be done, set up for the family unit at once? The answer to that is yes. We can do both tests for the whole family unit at once, and yes, we can still do it in the parking lot. Nancy is like a magician now doing blood draws from the car, so she's doing great. And if it's really hard or you're really uncomfortable, we can bring you in the office and draw your blood.
Yeah. We've had a few people in really, really high trucks.
Yeah, Nancy
can't get to you. So we can bring you in the office. Once again, we're taking all the precautions of wiping everything down. We do offer, we ask that you bring a mask, but if you don't, we have a couple masks that we can use for you in the meantime. So those precautions are in place. Lots of good mental health questions, and I think good site you would recommend for mental health resources regarding COVID-19 specifically, like maybe an online therapist you can text to. I don't know, Shay, do you have any specific referrals for that? There's a couple out there.
I agree with what's been said, that as far as like a crisis hotline, 211 is a good place to start. But if you're wanting like ongoing therapy, I mean, one of the biggest online services for that is betterhelp.com. If you go to betterhelp.com, there is a charge for that, but I think they do like a sliding scale, and it's a more affordable way to do teletherapy. So I've told many patients about that. So that's more for ongoing therapy. And if it's more of a crisis, I think 211 being a good place to start.
Yeah, we were talking about this this morning with my mom about the antiviral drug. Fred just posted that they're breaking news about the positive trial of the, I'm going to say it wrong, I look like an idiot, but remdesivir, I think it is. So we were talking about that this morning, and a couple thoughts on that for you guys. Like Shay was talking about, we're trying to figure out what treatments are going to be helpful for this in the long run, and so the more time that goes by, the more we can get real data on these things. It seems like the studies that they're doing right now are still those very early studies. Maybe this is a little more positive than the hydroxychloroquine studies, which were pretty pathetic. Let me rephrase that because that sounded very judgmental. That were pretty sparse in how many patients they were showing success in, and there wasn't a lot of clarity on that. So maybe there's more hope for this. At this point, though, this is not something that all of us are going to be taking for prevention. This is about looking at treating people with severe disease and trying to mitigate the effects of severe disease. So we have to take it slow, and we have to really give it time and try our best to not jump to start taking things without some clarity. So I don't know. Do you want to speak to that?
Yeah, I mean, I'll reiterate that I think it's probably the most helpful is maybe a glimmer of hope, is that all I will say about that. So once again, I mentioned that news happens faster than science, so we like to cling on to good news like this in a way that's hopeful, and it might be hopeful, but once again, we need a lot of time to really figure out its potential use and how beneficial is it. Is this really just for sick inpatients, and what's the true benefit, and all of these things. So once again, it is a glimmer of hope that there is something, like Shay was talking about earlier. Right now there's nothing, but there is something that can be helpful in the future, a treatment or a therapy. So hopefully that might be something, but it's too early to say. And yeah, we're going to have to keep monitoring the results of this study.
Thanks for bringing.
So you said something.
Oh, I was thanking Fred for bringing it up. And he muted me.
Accidental mute. Any other thoughts? So yeah, I mean, I think we talked about most of it.
Yeah. I think that's...
Yeah, that was all that was on my mind. Yeah. I just want to say again on the technical difficulties, I'm noticing now that I'm actually watching the live feed that there definitely is a delay. So if you've been noticing that my facial expressions don't seem appropriate for what James or Emily are saying, it's because we're a little off here. There's a lag. So sorry, I'm sure you all have already picked up on that, but I'm just noticing that, and so that's fun.
You're not really that awkward, Shay.
I kind of am, so I think that's why I'm a little self-conscious of it. But now you all just know that with me, so we're good.
Cool. So that's all we have. I think keep doing what you're doing. Stay safe. We look forward to doing this again. If you have questions in the meantime, feel free to shoot us an email and we can address it next time.
Wait, Jan's asking a question.
Question.
Ask it, Jan.
Let's see. I mentioned last week on total active count being a main concern with the number of patients in ICU and general hospital beds. Is there a known concern from within local hospitals on capacity issues?
We talk about this. Yeah, so there isn't actually, from what I've heard from certain physicians working in various hospitals and ICUs, that there is not an issue with capacity. They have systems in place in terms of surge, in terms of, if you hit a certain amount of patients in the ICU, adding more shifts. We have not seen that to date. We are currently prepared, it seems, for more capacity if needed, and that's why a lot of these decisions have been in process and been made in terms of figuring out how to open up certain retail businesses, parks, in a very focused and deliberate way. So it seems that currently we are in a decent position.
Yep.
Yeah.
Agreed.
Yeah. How are we keeping busy during social isolation?
We're doing this.
Yeah. It's true. We're doing this. We're homeschooling.
I love this question about California-based Zoom meetup groups. I would love to look into that. I think, having kids at home changes this experience quite a bit. So I would love to be looking for meetup groups, but I know that's definitely a concern, for other friends or family members of mine, and just kind of breaking up the monotony and all the days run together. And so I can look into some meetup groups and see if I have any updates on that for you next week, because definitely this is a good time to try to make the best of this time that we're in, see new and creative ways to make connections.
Thank you guys.
Well, thank you guys, and hopefully we'll make this better next time. Sorry for the technical glitches. This is working with all this different things. So awesome. All right. Well, bye everybody.